my name is Christian Brown, and I'm from the Biology 2401, Section 73, 428 class. And today I'm going to be talking about the bone identification for the axial and appendicular skeleton. The first thing I'm going to talk about is the skull. This top region here is the cranium. This is the frontal bone. These two are the parietal bones. On the side here is the temporal bone. Then here we have the zygomatic process, the mastoid process. This is the occipital bone. This is the foramen magnum. Right above that is the occipital protuberance. Then we have here the superior orbital fissure. And then on the inside there we have the inferior orbital fissure. Then we have the lateral bone and then the lateral fossa. Then we have the maxilla. Then we have the zygomatic bone, which is also considered as the cheekbones. And then at the bottom here we have the hard palate on the inside here. Now we're going to talk about the sutures. The first suture here is the frontal suture. On the back side is the lomboidal suture. Then we have the squamous suture. And then we have the sagittal suture. From the sutures now we're going to talk about the mandible. First we have the ramus, and then the body of the mandible. Then we have the angle of the mandible. And then here we have the mandible condyle, and then we have the coronoid process. And then in between the both is the mandibular notch. Now when we go toward the skeleton, we show the hyoid bone. It's this area here. Continue on with the vertebrae. I'm going to turn it around. Here the first seven, beginning of the first seven is the cervical region. The first one is the atlas. Then the second one is the axis. Then here, starting from here down, is the thoracic region. From the thoracic region is the last five, which is the lumbar region. And then from the lumbar region, here's the sacrum. Now the parts of the vertebrae, when I turn around here, we see the body of the vertebrae. When I turn it back around, we see the spinous process of each vertebrae. On the sides, they kind of stick out like wings, this is transverse process. Here is a transverse foramen. On the inside here is the intervertebral foramen. The intervertebral foramen. And in between each body or each vertebrae will be where the intervertebral disc will be. In between each one. Okay. Now we're going to talk about the sternum, this area. The first part is the manubrium, then there's the body, and then the xiphoid process. Then from the sternum, we're going to talk about the ribs. The first 7 is called the true ribs, which is also called the vertebral sternal ribs. And then from 8 to 12 is considered the false ribs, which is also considered as the vertebral chondral ribs. Now that was the axoskeletal. Now we're going to talk about the appendicular skeleton. We're going to first talk about the clavicle, which is this area here, which this part is the sternal end and this is the acromial end. And in between here is the acromion clavicular joint in this area. When we turn to the back is the scapula. When we turn sideways and remove the humerus, we will actually see the glenoid cavity. Right above it here is the acromion process. Then we have the spine. Underneath the spine is the infraspinosus fossa. And then right above it is the supraspinosus fossa. And in between here, this little area right here, which I tilted forward, right here in this area, that is called the subscapular fossa. Now when we look at the humerus, this area right here is the head of the humerus. This region here is the greater tubercle. This is the lesser tubercle. Then there's the coronoid fossa, and then we turn it the other way, the back side, is the olecranon fossa. Then we have the lateral epicondyle, and then the medial epicondyle. Then we have the radius, and then we have the ulna. On the ulna, we actually have the olecranon process, which is also considered as the elbow. And then from there we have the carpal bones. Then there's the metacarpals and the phalanges. We have the proximal, the middle, and the distal. Now we're going to move to the pelvis region. We have the ilium, that's pretty much on top. We have the iliac crest. Then we have the iliac fossa. Then we have the anterior superior iliac spine, this area right here. Then we have the sacroiliac joint. This region here is the ischial or the ischium. And then of course this is the ischial tuberosity. Turn it around for you. The ischial tuberosity. Okay. When we turn around, we see the, I'm going to lift this up, the pubis area, where we have the pubis symphysis will be here. The acetabular, and then the obturator foramen. Then we move to the legs. Okay. This is also known as the thigh bone, which is the femur. We have the head of the femur, the neck, the greater trochanter, and the lesser trochanter. Okay, and this is the lateral epicondyle. And then this is the medial epicondyle. And we bend the knee back, we see the patellar surface. Okay. And this is the tibia. Here is the anterior crest. Okay. Here's the tibial tuberosity. And here's the medial malleolus. Here is the fibula. And there's the lateral malleolus. Now we're going to move to the tarsus. It's this region. The first part is the talus bone. And then on the back here is also known as the heel bone, but it's also called the calcaneus. And then here are the metatarsals. And then the phalanges, which this is the proximal, the middle, and the distal phalanges. Okay, here's the bone identification. Thank you.